everyone, welcome back to my channel. This is Dr. Maha Wakarbek and you are watching Versatile Dr. Maha. So guys, here I am again with another video of mine, and like I promised in my last video, my today's video is gonna be on ketogenic diet. And what is ketogenic diet? So all of you who had seen my last video, they know for a fact that I am following a ketogenic diet, and today it's been 8 days since I've been doing that, and I've lost 3 kgs till now, and I'm pretty psyched about it. So yeah, like I said in my last video that I'm gonna make the video again. So here I am with a video on what is ketogenic diet and how it helps you losing your weight, what is the mechanism, and if there are any side effects and any complications and what they are. So let's get started. So the word ketogenic comes from the word ketones. Ketones or ketone bodies, they are, as if I tell this in simple terms, ketone bodies, they are a product of fat, which when fat is burned inside our body. So what exactly is a ketogenic diet? It is a diet which consists of 75% of fat, 20% of proteins, and 5% of carbohydrates. So what happens is normally in your diet, the diet which we consume, it has more of carbohydrates and then moderate amount of proteins and then less amount of fats. That is because our body is dependent on carbohydrates, which is used as a fuel. What happens is when we consume carbohydrates, it goes into our body and then it is converted into glycogen, and then this glycogen is stored in our body. So if we go on a fast or we start consuming less of carbohydrates, then that carbohydrate which is stored as glycogen, that is used as a fuel for our body. So that is how the mechanism of body works. So in this diet, what we do is we just take very little amount of carbohydrates, that is 5%. And which is not at all more than 50 grams per day. You have to take less than 50 grams per day carbohydrates. So what is happening here is that now once the body is short of carbohydrates, it will start using your fat, and fat will be consumed and fat will be burned, and that will be used as fuel for our body. So what happens is when the body starts burning fat and it starts using that as fuel, now these ketone bodies, this process is called ketosis. Burning of fat and producing of ketone bodies, this whole process is called ketosis, and that process starts in our body. And then more of the ketone bodies are used up, and then more of the fat is used by our body and it is used as fuel. So this way, this diet helps in cutting down of fat from our body. Now, what is the main point here is, I've seen a lot of people, who when they start ketogenic diet, they start eating a lot of meat and chicken, white meat, red meat, and thinking that they are consuming fat because they are frying it in butter and having it with cheese and everything. No, but what happens here, they don't realize that they are consuming more of proteins. So what is important to note here is that if we eat more of proteins, then those proteins, they go inside our body, they get converted to amino acids, and then those amino acids, it is taken up by the liver, and then again it is converted to glucose. So now this process, because of this, again you have glucose in your body, and once you have glucose in your body will stop taking fuel from your fats, and then again will start taking fuel from your glucose, and the fat which we've taken, it gets stored, and then this will work the other way around. People will start gaining weight. So if you're talking about ketogenic diet, it is no joke. One has to be very strict and very particular about it, and it is my suggestion to all of you people who do want to go on a ketogenic diet to reduce their weight. They should consult with their physician and then a dietitian, and only eat whatever the dietitian recommends, because there are a lot of misinformation about ketogenic diet and a lot of people do it wrong and eventually end up gaining more weight. So this ketogenic diet, it is a very fast way to reduce your fat, and people who are obese, they can definitely follow it. But having said that, like I told you guys before, one needs to consult their physician and dietitian. Now, what to eat once you're following a ketogenic diet? One can have fats, not all kinds of fats. Trans fats is very harmful to the body and especially to your liver. Because if you are taking a lot of fat, and that to trans fat, it will affect our liver, resulting in fatty liver and other complications. So one has to make sure that people are having healthy fats. Healthy fats are monounsaturated fatty acids, polyunsaturated fatty acids. These are all healthy fats. Along with taking all these fats, one should also take green leafy vegetables and high fiber content, because a lot of people, they tend to go into constipation once they're having this fatty diet. So having green leafy vegetables which are low in carbs, one should take those vegetables, and one can also have these nuts like almonds and peanuts and pecans and walnuts. So these are few fruits, dry fruits which contain healthy oil, and they are really good and also act as a source of fiber. So these are the things which you can eat, and I will again make a separate video on what to eat and what not to eat once you are following a ketogenic diet. Now let's talk about the side effects or complications of ketogenic diet. So talking about the side effects first of ketogenic diet is there's this word called keto flu. So what happens in keto flu? Once you start your ketogenic diet, in the first 3 to 4 days, like I said before, the body has stored glucose in the form of glycogen, and the body is still using glucose from that stored glycogen as a fuel. So the ketosis doesn't start within the first 4 days. And during first 4 days, one can experience, fatigue and laziness, lightheadedness, a little headache and nausea also sometimes, or vomiting in some cases. So these things are called keto flu, but these will happen in the first 4 days. It is very important to keep yourself hydrated. So I'll come to that again about hydration and drinking a lot of water. So these are the keto flu. These are the symptoms for keto flu, and because of these symptoms, people can feel a little low, and then people want to quit it. But these are temporary, and then people are just fine after that. And personally, in my experience, thankfully I did not get to experience any of these symptoms, and I did not suffer from keto flu. So thankfully, it's been great till now. Now these are some side effects. Now let's talk about the complications which can happen if you do not follow the diet properly. Number one, there can be kidney stones because of a lot of salt is lost from the body, and there can be kidney stones. Number one. Number two, decrease in blood pressure. So again, taking high amount of sodium is important, and taking high amount of water. Lots of sodium in the diet is really important. Number three is decrease in sugar level in the body. So patients who are diabetics, they need to consult with their physician and also get their dose adjusted, and only then start the ketogenic diet. And number four, there can be some mineral deficiencies. Mineral deficiencies, of course, because there are certain things which you cannot eat, so there people can suffer from mineral deficiencies. So it is important that people take their vitamins and minerals while they are on this diet. So it is really important for people to be really careful, keep monitoring their blood sugar level, their lipid profile. So I personally advise to all of you guys who are planning to go on a ketogenic diet to get all the profiles done every 15 days, so that you can keep a check on your all the levels of if the levels are doing great in your body or not. So these are the complications of the diet, and these complications will only occur if you are careless with your diet. If one follows it very meticulously and done properly while consulting your physician and dietitian, there would be no such complications. And I have known so many people around me who have done it properly, and they are doing really well, and they have lost a great amount of weight, and apart from that, their skin and everything is always glowing, because again, the reason of acne and everything is carbohydrates. So I think ketogenic diet is good to follow, and for me it is a yes, and that is the reason I'm doing it. And I would also suggest other people to try it if they are suffering from obesity and excessive weight gain. So yeah, I think that was a concise video about ketogenic diet, and like I said before, I'll make a separate video on what to eat on ketogenic diet, and how, if you want to fall back from ketogenic diet, and then how you can smoothly transition from ketogenic diet. Because disadvantage of this diet is that people, as soon as they are done with their ketogenic diet, the weight gain is really fast and people gain a lot of weight immediately. So one has to transition back to their normal diets very smoothly. So I'll be making a separate video on that. And so all of you who are going on planning, or who are planning to or going on a ketogenic diet, drink lots of water, stay hydrated, take lots of your minerals and salts, and do not go on a ketogenic diet without consulting your physician and your dietitian. This was all about ketogenic diet. I'll see you on another video of mine. Till then, take care, you guys. Bye bye.